So I'm going to set up some agenda topics for today. We'll get started right away. So the first thing is Lauren and I have been talking about the pharmacy world for such a long time. And me as an MD, as a physician, I really honestly didn't know what pharmacists actually did, to be completely honest. And I was shocked when I learned. And then I looked at what she was offering in FMPHA. I'm like, whoa, there's a lot more than I thought. So, as a physician, and in my group of physician friends that I coach, I started letting them understand what pharmacists actually can do. We're like, why aren't they part of the equation? It makes absolute no sense. That was March of 24. All right. And so I had in my mastermind, in the physician group, we're like, you know what? What if we can get pharmacists into clinical integration? And what if we can do it with a holistic approach, functional medicine approach, integrative approach? And my challenge for my friends to me is, hey, Cheng, make this into a scalable business value proposition. I'm like, okay, we'll do it. So a few months later, it's October 24th. We have a lot to share. And so, but this is how it all transpired. And the other thing is I also don't think that with a lot of pharmacists truly know what really goes on in integrative health practices as well. And so I thought Lauren and I were like, you know what? Let's have a meeting of the minds. And this is super last minute because this is supposed to be a discussion between us in our group. And she's like, why don't we just invite everybody in on the discussion? I'm like, thank God. Let's do it. Let's invite everyone in on the discussion. So, Lauren, I'll have you describe the background of what this is, and then we'll get started.
Yeah. Hey, everybody. So I feel like I know most people on this call, very excited that you guys could join us live. I really, more than anything, wanted you all to get a chance to meet Cheng because he has been absolutely transformational in my own life. We met at a PLMI conference in 2023, I think, and then stayed in touch last year. I was going through everything crazy with my job and leaving Walmart and all that good stuff. And then he's, yo, you got to come to my retreat. And I was like, no, you got to come to my retreat in Costa Rica. He's, no, really, we need a pharmacist there. Like we have all these different practitioners. We don't have any pharmacists
Yeah.
coming to this multidisciplinary retreat. And I was like, okay, I will be the token pharmacist and I will come to your retreat. And it was absolutely just incredible, amazing, life-changing. And from there, that was really where it was like, it just felt like I had found the right person who could help us to finally tap into this true collaborative model. Because as much as the work that we do within FMPHA is so vitally important to bring pharmacists into the functional medicine spaces and again, help teach and educate what exactly does the role of the pharmacist look like? What are our skill sets? What are we capable of providing to the team? And then, of course, on the pharmacy side, trying to educate our traditional pharmacy colleagues on what is functional medicine and how can we integrate that into pharmacy practice and the existing roles that we have today. There was still this missing piece that really had to do with this collaborative and truly integrative care model. And that part, I don't think is going to come from any of the avenues that we have around us yet. It really is the genesis of something new. I think there's some examples of it, of pharmacists that are starting to get into more of these collaborative practice roles. But with so much changing in the profession right now, between obviously independent pharmacies that are constantly struggling to even stay open, if you're working in corporate medicine, in hospitals, in chain pharmacies, there's all kinds of other pressures and cost-cutting measures being done that you really can't operate to your own capacity in the way you would like to because of all these restrictions. And so what's the option that we have? And that's where I really think that the third option that a lot of pharmacists, I think, have seen over the years now with this functional medicine. Of course, COVID kind of accelerated all of this with telemedicine, right? This has started to become like, oh, I want to be a pharmacist that's just working directly with patients. And so then there's this idea of, okay, I'm going to just open my own functional medicine practice. really and truly, it's being a consultant pharmacist, right? Like we don't always think of that word, maybe, perhaps. I know for me, like in pharmacy school, ASCP was the group that did that, and I always just associated it with geriatric pharmacy. But more and more, the consultant pharmacist role is starting to be the word that we use for that. But even still, that doesn't quite capture it because it's still this sort of outside approach that we're having to come into these places. And as Cheng and I have continued to just really dream and imagine, how do we leverage a pharmacist? If we could just create like the perfect role for them, what would that look like? And what I believe is that it is actually taking the pharmacist and putting them on the front line and in the office with the physicians, taking all of those things that are just huge time sucks for doctors, nurse practitioners, PAs, right? And being able to say, okay, what if you guys can really focus on what you do best, right? Patient comes in, have to figure out what's going on, come to a conclusion, a diagnosis, right? Like really do that deep digging. But then pharmacists are really and truly the pharmacotherapy experts and really the treatment experts, right? When it comes to understanding evidence-based medicine, right? That is what is hammered home for us in pharmacy school is how do we make sure that we're using the right medications, the right treatment plan for the right patient at the right time, at the right dose, all of these things that our brains just think this way. Like we can look at a patient and have a list of diagnosis and tell you right off the bat, oh, whoa, hold on, we got to fix all of these things. That lens, the way that we think is different. It's unique. And for the longest time, I think pharmacists have really been trying to just fit into the functional medicine space and try to just be another version of a functional medicine practitioner. And really and truly, it's time that we embrace what makes us different and what makes us unique and use that as our superpower. Use that in collaboration with the full medical team so that we're not continuing to operate in silos and we're not just tying our worth to a product or a supplement or a prescription that we're dispensing, but that we're actually getting paid for the interventions that we make. And again, this also ties into making functional medicine and healthcare as a whole accessible and affordable. It's another huge barrier that pharmacists, if you're not in collaboration, it's very hard to get those reimbursements from an insurance perspective to be able to serve those patients that probably need our help the most. And so this is yet another area that Cheng is an expert at, is actually getting integrative medicine covered by insurance plans. That's not something that very many people have really figured out yet. And so if we can bring all of this amazing work together, integrate the pharmacist into this model, then I think we actually do have a chance of really reinventing healthcare. So.
Well said. Awesome. Thank you for that. And it's bi-directional, Lauren. I think you revealed a lot of the pain points that I was trying to deal with physicians on our side within the pharmacy world. Honestly, they're pretty much identical with little caveats here and there. But just so y'all know, over the last 4 years, I've been working with dentists to incorporate them into the medicine world. So we started this idea of airway medicine, where we realized that airway disorders in dentistry are the leading causes of people being on medicines such as narcotics, blood pressure medicines affecting their blood sugar. So we came up with a disease management model for them. But the dentists the hands are tied because they can't do prescription or deep prescription. And so over the last 3 years, we've been working with them on this and came up with the entire multi-society interaction between dentists and physicians. But honestly, we're missing the pharmacy piece. And there's a lot of pain points that we do in terms of lifestyle management and functional medicine that I really don't like. I really have a hard time getting into a prescription, deprescription management just from a mindset perspective because I'm not trained in it. MDs are honestly poorly trained in pharmaceuticals and side effects. We're really poorly trained. So my father is the dean of pharmacology at University of Houston Pharmacy School. For now, he's retiring in a month and a half. For the next 6 weeks, he's still the dean over there. And I learned a lot from him teaching pharmacy students as well. So I guess it's in the family. I guess it's in the family. But first, we're going to do what's called a gap analysis. First of all, has anyone heard the term gap analysis here? I'm going to look at everyone's screen. Okay, Ashley, you heard of it? Bridget, you heard of it? Gap analysis. All right. Can someone give me a definition of a gap analysis? Or what you think it is? There's no wrong answer. Da-da-da-da-da-da. Anybody, unmute yourself. Give me a definition. This is going to be interactive.
The space between where we are and where we want to be.
Exactly. That's it. The space between where we are and where we want to be. A gap analysis in business is the very first thing we do to paint the vision of where we want to be. So you can do it from a big picture, and then you can do it from a departmental standpoint or granular standpoint. All right. So my first gap analysis, and this is what I like to do for all my coaching groups, my first gap analysis is asking you, the audience, why the hell did you come onto the Zoom today? I'd love to hear from maybe 3 people, and everyone else just type into the chat box so I can actually see. Why did you come onto the Zoom? Was it from LinkedIn? Is it from Lauren's emails? What was it from? Why did you come in?
LinkedIn, and because I love Lauren and I like to support stuff that she does. And we went to Costa Rica together and all sorts of reasons beyond that. Primarily because I'm one of the pharmacist people from Lifestyle Medicine Interest Group, and we're trying to figure out the same questions. Like, how do we get pharmacists to the table? And I was like, I got to know this guy. So here we are.
Awesome. Awesome. Anybody else?
So here, Bridget.
Yeah. Awesome, Bridget. Anybody else?
Can I say something?
Of course.
Okay. Is that too loud in the background? I'm like walking around the neighborhood.
It's beautiful outside. I wish we were hanging out with you.
Yeah, I'm like really interested in functional medicine, and I'm trying to figure out how to get into that space. I do my own thing on the side as an independent consultant, but I don't see too many people. So I'm trying to figure out how to grow my business or to get into something full-time that I love to do, which is helping people get better.
Great, great. Love it, Lawrence.
Yeah.
We actually have a lot of interest here. I've probably seen about 50 patients that just pay cash to see me here at the pharmacy. So knowing how you guys are doing this and trying to figure out what to actually do. I do actually have doctors sending patients to me. So continuing to set that up would be nice to figure out what everybody else is doing it, because we think we're just flying blind over here.
Gotcha. What's your name?
My name's Catherine Seelman. So I own 12 Corners Apothecary in Rochester, New York. So we're struggling trying to figure out our policies, procedures, processes, and things like that. But we definitely have a demand here.
Okay. Yeah. The 3 Ps are my favorite word: policies, procedures, and processes. It gives other people a headache, but it gives me a sense of fulfillment. That's a much bigger discussion than today's. But it requires us to understand the gap first, and then we set it up. So thank you so much for saying that, Kat. Appreciate it. But just throwing another P of pricing. Yeah, that's another 4-hour discussion as well. But we'll get to that. All right. Anybody else? We'll take one more person to just unmute and say, hey, what was your real purpose for getting on here? Because I want to make sure everyone leaves happy. That's my role. I'll make sure all of you want to leave happy. Y'all can literally undo your mic and say ditto to whoever just talked last and stuff like that too.
Mm-hmm.
Yeah? Okay. Okay. And then Maureen says, pharmacists with MPH previously in hospital practice, now working in federal government, getting increasing frustration with the current model of healthcare and overprescribing versus prevention. We actually have the answer for that. Yay. Awesome. Considering providing services as part of my husband's counseling practice. Oh, that's amazing. Mary, is it psychological counseling? Or is it business counseling? Or is it none of the above? I don't know if Mary's on here. Is she on here? There's so many people I can't see. Let's see. I'm tired of.
Hey, sorry, this is Mary Margaret. Yes, it's psychological counseling. He's a marriage and family therapist.
Perfect. We actually have a model in Dallas.
Ooh, cool. Great.
Is Mariah in here? She's not in here.
I don't think so. I told her, I was like, you guys should both join.
Yeah,
I'm in Tennessee. That's great.
Yeah. We have a psychology model in Dallas with medical insurance and CPT codes is really good. in psychological counseling, like really good in terms of Medicare reimbursements, better than like cash-based services.
Oh, good. He's
Yeah.
primarily cash, but I know it'd be harder to get them to pay extra for me. So I'd love to hear more about that.
But remember, they can submit the super bill on the back end,
Yeah. Yeah.
right? And they sometimes they actually get more from the insurance if the super bill is done correctly. And that's part of the PPP, the policies procedures, that we have to make sure that gets done first. Awesome. So that's definitely possible, probable, and in the field of psychiatry is actually the best in terms of business model.
Awesome.
Which if y'all are in functional medicine, then technically we're all kind of psychiatrists anyways. Let's face it. Awesome. Thank you. Okay. All right. First of all, thank you all so much for saying that. And Lawrence, I really wish I was with you outside. I love the outdoors. The trees are really beautiful. I'm gonna have you on my screen enlarged on this side. All right. So it sounds like there's a gap here. And the gap here is like conventional pharmacy practices and conventional models, right? We're talking about systemic conventional models and private models. All the models require some sort of reform. Otherwise, we'll just be in the dark. Now, has anyone integrated artificial intelligence into their policies, procedures, and the practice, anything like that? Yay, nay? Type Y for yes and N for no. And I am not talking about using ChatGPT to do X, Y, and Z. I'm talking about actual AI engine in the practice. No? No? Okay. Okay. All right. Oh, I'm missing out. I'm so scared of AI. Jamila says, don't be. Using AI for charting. Great. That's awesome. Everyone should be using AI for charting, but nothing integrated. No? Okay. Awesome. If you're on the Zoom, we're actually using AI. The Zoom AI companion is actually going to be providing a summary and outcomes and objectives for this meetings, right? All right. So there's a technological gap, there's a systems gap, and there's a financial gap. That's what I'm actually seeing from the chat right here. A technological gap, a systems gap, and a financial modeling gap, right? And so this is all of healthcare, right? And these are the three gaps that I have really tried to do within my practice. So for those of y'all who don't know me, my name is Cheng. Hello. I started Texas Center for Lifestyle Medicine on my chest right here. And Lauren, you're wearing my nonprofit shirt, PTI, the Physician Transformation Institute. Awesome.
That's right. Had to represent.
Represent. And PTI is my nonprofit arm, and then Texas Center for Lifestyle Medicine is the for-profit arm of us delivering the medicine care, and then PTI is the education arm. So my journey really started in 2021 when I hosted the Physician Practice Automation Summit, and we did a gap analysis of about 56,000 doctors in North America, trying to figure out where the gaps are. Same thing, right? Technological gap, systems gap, and then financial gap as well. And so before that, in creating Texas Center for Lifestyle Medicine, the whole concept behind this clinic is not, the endpoint is never to be a clinic. The endpoint is to be an educational system, to seeing if we can deploy integrative health solutions within Medicare and government insurance and then private insurance models. That's the whole point of the actual practice. So we don't do any cash-based stuff at all, zero. So we work with local integrative and functional medicine doctors. They actually refer in. That's how we started first. And then we could start being referred to by conventional doctors, primary care practices. Then our biggest referral was the VA, the Bayview VA here in Houston. All right. And then that turned into University of Texas Medical Systems. That turned into now our biggest referrals are dentists by far. What dentists have found is that when they treat the airway, sleep apnea, bruxism, stuff like that, the medicine is too much for them and they cannot get a doctor for deep prescription other than us. So a dentist won't even do their procedures until we have clearance and we're managing their prescriptions over time. Wow, that's cool. That is by far over 50% of our referrals are from dentists, okay? And so now that's a pain in the ass for me, to be honest with you, because like deep prescription is not, number one, it's not easy. Number two, it's a lot of Googling. And number three, it's a lot of texting my friend Steve, who owns Magnolia Pharmacy here in Texas. Hey, what do I do? What do I do? He's a pharmacist. And so that's been the model since 2019, where we had to create our own SOPs. And then we published our SOPs nationally for other people to take. And then for other dentists who work with primary care doctors on de-prescription, initially it was blood pressure medicine and diabetes medicine, and now it's narcotics and ADD and ADHD medicine. We started a whole new psychological integration with dentists, where if the patients are prescribed like bite splints, technically they have less beta triggering in the brain, and they can taper them off of Vyvanse and Adderall like pretty easily, right? So these are things that are now standard within, we call it the airway medicine space. And so, but the pharmacist part has always been missing. So I told this to Lauren a while back, and we're like, where does this kind of fit in? So first, let's address the elephant in the room, right? There's a big marketing problem when it comes to the field of medicine, especially pharmacists, right? Because in reality, I had no idea what y'all did until I met Lauren, like deeply to the core. And the second is I had no idea that we're fighting the same battles. So let's address that for a second, is that y'all are trained in a field that's far surpasses MDs and physicians, right? And in this field is the missing piece that unlocks healthcare. It really does. It really unlocks healthcare. And so the idea here is, are we able to elevate healthcare when we set up a system of value chain? So the term value chain, has anyone heard the term value chain? No? Has anyone heard the term supply chain? If you're a pharmacist, you should have heard the term supply chain, right? If you're able to dispense, that has to do with the supply chain. A supply chain is a chain of supplies, and these chain of supplies are managed by different people, okay? Until it gets to you and gets to the patient. A value chain is the exact same thing, except it's services, a value chain. So a value chain looks like this, right? So let's say that I have patients, and let's say they get scheduled on my scheduling calendar. First, they see the website or Google reviews or something like that, right? And so the person in charge of that will be my marketing lead. So my marketing lead is the very first person in the value chain, okay? Delivering value to the patients. Second, the patient has a call to action and calls the front desk to make an appointment. So scheduling is a second value chain, right? So scheduling comes up and after marketing, right? And the third person in the value chain is insurance pre-verification, where we give all the information for the patient to do insurance pre-verification before they see the practice, okay? That's the third person in the value chain. And then the fourth person in the value chain is the front desk when the patient shows up to see a doctor, right? And that's the fourth person in the value chain. So these are these chain of values. What happens in all industries, including pharmacy, is that the value chains have overlaps. What happens is that if the person involved in marketing is also the scheduler, right, and also happens to be the pharmacist, right, or the doctor, and what happens is that this systems of values, there's so much overlap that's right there, because you can have two people doing the same things. When you have an overlap, it automatically cancels out and that thing gets dropped. So that's the value chain. And so whenever you think about the value chain between a physician and a pharmacy, right, what's happening is that the patient is getting value by being prescribed something, and then they go to the pharmacy, and the pharmacist is also providing discussions about side effects and counseling, or it's a vaccine, maybe vaccine counseling. But what happens is it never really makes it back to the physician, so it ends right there. So the value chain ends. So whoever's at the very end of the value chain suffers the most trauma if there's no loop to go around. So financially speaking, you have to develop a system where it loops around. And in 2017, that's exactly what happened. The Center for Medicare and Medicaid Services, along with the AMA, the American Medical Association, created what's called a collaborative care reimbursement model. And the collaborative care reimbursement model is the most popular thing that no one's ever heard of, all right? And so there's actually a value. If I pick up the phone and talk to you, a pharmacist, my 5-minute conversation is worth $60 to me and $40 to you. All right, a 5-minute conversation, right? And so there are actually systems that are like that, but you have to set it up where it's built out the right way under the right MPI, and the policy procedures aren't necessarily there. So that's an example of tying together the value chain, right? So in the field of integrative health, it's all about collaboration. All right. Well, it should be. It's not always the case, but it should be all about collaboration. And so what I'm finding is that a lot of people with integrative health practitioners have a frustration, is that this doctor won't collaborate with me, or this person won't collaborate with me. They think I'm nuts. They think I'm cuckoo. They're calling me a quack, right? I've experienced that before. I don't know if anyone else experienced that before. Yeah, people are smiling and laughing, so I assume that's the case, right? So what happens is that there's no value chain that's set up to tie back into the outcomes of the patient. All right. And so question is, who tracks the outcomes? If you're in a hospital system, the hospital system is supposed to track the outcomes, decrease hospitalizations, decrease ER visits, right? But if you're in private practice, is it the pharmacy that tracks the outcomes? Is it the physician? There's no value chain that's set up there, because outcomes is what actually ties in together so the business can continue to rotate. So the perceived value proposition to the patient becomes higher and higher. And the patient's, man, I am being taken care of. That doesn't exist as a system right now. So that's a system gap analysis, a system gap. And so imagine, and Christy, I'm so glad you put that, why hospital pharmacists have shown their value, because they get to loop back to the prescriber. Absolutely. When you get to loop back to the provider in a system, especially like the VA and stuff like that, there's communication there. But even in hospital systems, hospitals are struggling, okay? And they're trying to hire staff that doesn't have a lot of experience in this, is because they haven't made that into a business center. But the reality is there are reimbursement strategies and policy procedures that we're able to install within the systems perspective. All right. Now, having said that, what if you have a casting on the side, like Lawrence, you have a casting on the side, right? It's the same thing. There's no difference. So let's say that you're providing value to a patient, right? Inevitably, the patient wants communication with their physician. That's always going to be the case, right? Or the patient's so fed up with the medical system, they just want you to take care of them, right? The latter is not scalable. The former is. When you have a collaborative care system of a value chains, it's actually very scalable and deployable. So what we want to do is take pharmacy out of the silo, just like we took dental out of the silo over the last three years, right? Let's take pharmacy out of the silo and say, how do we close the loop on the system of values? This is where artificial intelligence come in, all right? So in our practice, the reason we see patients eye to eye without looking it down and typing, the reason we actually do that is very simple. AI does everything on the back end. I know that what I'm talking is being captured in the structure format in the right setting, and it knows that I'm going to be sending this consult note to the primary care doctor. I might be sending one to the pharmacist, right? And after the conversation, it understands the conversation to repopulate that. So that gives me a note to send to the pharmacist. This is our deep prescription plan, right? And we work with our PCCA pharmacists around here for those systems and outcomes. But first of all, I'm dyslexic. And second, I hate typing, probably because I'm dyslexic. And so I need AI to do all that stuff. But more importantly, let's say I saw those patients a month ago, right? And the AI has captured that data. I'll say, hey, AI, which I call her Shirley. My AI's name is Shirley. Hey, Shirley. It's from a joke. If y'all have seen the movie Airplane, it's from a joke. I'll say, hey, Shirley, you can help me, right? Let's give me an output where I can talk about this with innovative pharmacists. Furthermore, here's some information on how we changed medicines over time. And let's provide a note to their ENT, let's provide a note to the pharmacist, let's provide a note to their dentist, provide a note to the dietitian, let's provide a note to a health coach. Boom, but 15 seconds later, notes for here, and you have a collaborative care model, and each note is worth $41 for me, all right? Because I bill for it, right, through medical insurance. If you're on the cash side, think about, like Lawrence, think about how much value you can provide if you actually are the center of the web, right? If you're not just like at the end of a spoke. You're really at the center, and you have, hey, let's get AI to provide a master communication device. So it doesn't really matter what you do in terms of providing for the patient as a provider, right? All it matters is that you give them unconditional love. How? Through collaboration. Collaboration management is the language of unconditional love for our patients, all right? So you don't have to know all the answers for the patients, but you can provide them with, I don't know all the answers, but I'm here to support you. And guess what? I got a system to communicate, right? And so if at the center, at the core, you are the architect, right, of the patient's world, then that feels good, but it can burn you out. Who's been burnt out before, by the way? Just out of curiosity. I'm raising my hand. Shit, have I been burned out? All right. Lauren, you haven't been burnt out before? So
I've definitely been burnt out.
definitely been burned out. But what's happening is that for the first time in history, artificial intelligence has given us some tools where the technology is actually helping us and not pinning us to the wall like a stake, right? Because in the physician world, electronic medical records, although they're nice, but they've created a lot of burnout. There's a lot of clicks, systems, processing. We're not looking our patients in the eyes. So the AI can actually create a lot of different things based on what you want. In reality, you can create whatever you want. Yesterday, we just created a video, all right, of me talking 250 languages. We did it as an experiment. And I'm thanking for the patient for being in the practice, all right? What's happening here is someone will type in the name of the patient and I will mouth the patient's name. All right, the AI is reprogramming it. So I'm mouthing the patient, hey, Melissa, thank you for joining the practice. Really enjoyed seeing you. It's a personalized message that's right there. I can say in Spanish, Korean, whatever. And so we're at this world right now. We're at this point right now where technology has advanced so much, but it's been accessible really only to non-medical people, whether it's marketers, social media influencers, et cetera, et cetera. But the reality is it's missing within the healthcare field. And so understanding artificial intelligence and what it can do can actually create a bridge over into the gap, understand your own gap analysis, processes, and procedures, right? And what you can do is you can become the architect of your own world, because that's what you want to do. You want to become the architect of your own world, right? But let's take it outside of patient care. Let's talk about teams. So if you're a leader and you actually have teams that are working with you, now my definition of a leader is someone who leads someone by being beside them or behind them, never in front. That's my definition of a leader, right? If you're in front, you're just dragging along people with you. But what happened is that if you want to be this really impactful leader within your organization, you can use artificial intelligence to turn a lot of your systems and processes and individualize them to the person that or the people that you're leading. So for example, we have huge policies and procedures manual that we're getting rid of this year because the AI is able to understand the employee's personalities profile and create a training specifically based on their learning style now. We switched to that. We're switching to that in January, right? And yes, Ashley exists. I saw that look on your face of disbelief. And so what's happening is you can do that too. And honestly, you can do it in a weekend. I'm not talking about, oh, I have to spend 6 months. That's BS. You could literally do this in a weekend. And the technology exists now. And when I say now, I really mean as of 3 months ago exists. So we're really just at the very forefront of this. Technology exists now where you can make very individualized training processes for the individuals, and you can use wording and language that makes them feel like they're part of the team and reducing burnout. Because at the end of the day, the reason I created my nonprofit is to create anonymous mental health services and for healthcare professionals going through suicidal ideation. That's the whole reason I created my nonprofit, right? So in order to end the burnout, we have to create this value chain where people know their values and they own up to their values, and you can use technology to do that, and you can use the gap of understanding where someone is to train them. Now, believe it or not, I use this on my daughters as well. So I use it for parenting. I use it for talking with my family, especially my dad, who used to trigger me a lot, but now we have a great relationship with the help of the AI. But masterful communication is another huge gap because without masterful communication, there is no value chain. And when there's no value chain, when the chain get corrupted, that's what the root cause of the burnout is. And that stops the scaling phenomenon to occur. All right. And so in this field of integrative health, and I'm going to speak the truth. Functional medicine is really disjointed, to be honest, right? If you think about functional medicine training, you got this IFM toolkit, you got this thing that's right here, and then like all of y'all are giving the how, but operationally, like how do you glue that together? It's a big missing part that Lauren and I are just disgusted over every time we talk. The PPP The people, policy, and procedures. Like that's not there because they can give you a policy, but the execution is done very poorly because they haven't done it, to be honest with you. Like the leaders within the functional space themselves haven't really done a great job within the organization either, right? And so what we turn to are people who have done this at a higher masterful level. And those may be people outside of healthcare, which those are my leaders, which is really outside of healthcare. And so, yeah, Lauren, you said different tools for different schools. Is that what you said? Yeah.
Mhm.
Yeah, different tools for different schools. It's actually, it's creating a system where it even becomes more siloed. So in creating these tools, we have to match the gap. We have to close the gap of technology, which is really easy now. You don't even have to know a single line of code to do this. And by the way, my background is robotic process automation and machine learning. So I taught myself that going through a residency to try to create systems that work from a technology standpoint. But now you don't have to know a single line of code. And now, in order for AI to come into play, you have to treat it like it's a masterful guide for you, right? I don't tell the AI what to do. I get the AI to let me know what to do. And that way you place the technology on a high value system, allow it to tell you what to do, but you're feeding it information about you and your desires and what you really want to do, like at the core, right? And so that allows the values and the systems to flow through you, to your team, to your organization. All right. But what if you're on the other end? What if you're lower on the totem pole? It's, hey, I'm down here and people are telling me what to do. And the worst is when you get stuck and everything falls on you. Who's been in a position where everything has fallen on them in an organization? I have. Holy crap, I hated it. When everything's falling on you within an organization, what happens that is you become everything to everybody, which means that you basically are the slave at this point. And slave not meaning a bad term, slave meaning that you are taking commands, right? So what happens is if you're at this position right now, what you have to do is the first people think, oh, I got to get out of this business. What you can do is ask higher quality questions, provide that for your organization, and then you can ascend in your organization as well. And that's where the AI comes in as well. So there's a huge gap between where you are now and where you want to be. You can actually close the gap, right? And a really good example is we had one of our dentists that is a new dentist at a really large organization, Smile Dentistry. So it's got thousands of, maybe tens of thousands of locations in the US. And what she really wanted to do is have a really holistic approach to dentistry and work with doctors and for deep prescription management and stuff like that. And one of the things that always was what came on her is because she was part of a locational site, she was in charge of the systems and operations, the employees, the training and stuff like that, having no training in it whatsoever, right? And she has no time for training. She's a mother of three, going through a divorce, like all the things. Let's just put it that way. It really burns out. And one of the things I noticed is that what she was doing is she was being the yes person. Yeah, okay, I'll do it. Yes, I'll do it. Yes, I'll do it. Who's been there before? I certainly have. Yeah. Okay, yeah, I'll do it. And what happens is that the person in that position has a hard time setting boundaries, right? But me, I'm the CEO of my company. Doesn't matter who you are, whatever your value is, I want you to set as many boundaries as possible. I want you to curse at me if you have to, right? Which my medical assistant Caesar always does on a daily basis. He's a combat veteran. That's what he does, right? And so what happens is that you can create a systems of communications where you're utilizing words. I think Lauren says words as spells, right? Words are spells. You're using words as spells, meaning that you're utilizing these words as a highly effective communication. You can do that through artificial intelligence, right? By asking higher quality questions. So if you're doing all this stuff and it's not going anywhere, and you think most of what you do is a waste of time, AI can actually look at the things that you're doing and within 15 seconds give you an output of, hey, this may actually be time wasted. So let's do this another way. And you can utilize that in your organization as well, right? You can have that in team meetings, and hopefully you'll have team meetings if you're employed. If you don't have team meetings, if you're employed, I'm sorry, but hopefully you have team meetings. And that will create its own fire, like campfire, and the fire will spread, right? And then you can get into higher positions and everything like that, right? And so this whole discussion right here in the first part is the gap analysis. I saw where everyone's gap is, right? And how we can approach it is by creating this center of values called the value chain. When you have a value chain that's created from a business standpoint, even from a personal standpoint, it allows everyone to know exactly what to do with very minimal actual communication, right? You should be able to look at somebody and give them the handoff and be like, okay, and they do it, and you should have 1,000% trust in that person, okay? By the way, who owns their own businesses here? Just not a show of hands, just curious. Okay. Oh, most people? Okay, cool. Awesome. So let's say if you're a business owner, and there's some solopreneurs, and which is cool, but even with solopreneurs, maybe you have virtual assistants. Who's got virtual assistants, just out of curiosity? Okay. Maybe you have virtual assistants, or maybe you have an actual physical employee that's with you. Maybe you have other people in your organization that's volunteering to be your time while you're in your startup. So what happens here is that if your value chain is not set up with, let's say, your assistants and other people, inevitably it still comes on to you. And so one of the big things I hear is in people in leadership positions is I have more employees and therefore I'm burnt out. If you have more employees, you shouldn't be burnt out, right? But most people do. And it's because the delegatory value chain is not there and there's no close-end loop. My friend texted me this morning and my accountant tells me I owe $12,000. I'm freaking out. I'm crying. I'm like, why? And she's like, I'm supposed to pay this in quarterly taxes and I'm short. I was like, well, you've been working with my organization. Does your accountant know that you've been working with a nonprofit and the time that you actually donate is considered a tax credit? She's like, what? I'm like, yeah. So went back to her accountant. She doesn't owe $12,000. The government owes her. This happened in a span of 3 hours, like this morning, right? So what happened is that she did not set up a value chain with her accountant. So the value chain is, this is my expectation. This is what I want to do. And I want you, the accountant, to let me know these are the things that I'm doing. What can be created as a tax credit so I don't have a huge tax burden? So that's called closing the loop in the value chain. Just like the patient gets a medication, the pharmacy has a side effect. Who hears about the side effect first? It ain't the doctor. It's usually when they were picking up the refills at the pharmacy, right? And so patients are terrified of talking about side effects to the doctor. Oh, I don't want to upset my cardiologist. I hear that every day. It drives me nuts. I don't want to upset my cardiologist, endocrinologist. I'm just gonna grin and bear it. But I'll blame the pharmacist, no problem. That happens a lot. And so what happens is there's no set of chain of values to come back around. Just like this business owner with the CPA, they didn't set a chain of values and checks and balances. The patient doesn't have a chain of values that if you have side effects on this, I want to provide value for you. Okay. Although we can send a message to your doctor, which doctors rarely read pharmacy messages going back to them because they're burnt out as well. Let's do a full analysis of what's going on with you, right? And then maybe we can work with the doctor. And if the doctor is smart or they're in my coaching group, they'll say, hey, I have a connection that I want to have with this pharmacist. It's a 5-minute conversation. And I know that I can do that on a Friday sipping on a latte and generate $40 for the 5-minute conversation. So there's a business proposition there for the collaborative response, right? And so for my doctor's group, I'm saying that if you're working with a dentist, a pharmacist, a dietitian, a health coach, like whoever, and you're having a conversation about them with the patient, that's a billable event. And if you're a cash practice, that's a huge value proposition, right? If you have something a cash on the side, it's a huge value prop to close the loop and then end right there, so that you're able to deliver this high quality value for the patients and for yourself. Because at the end of the day, you want to go home not burnt out. You want to show up to yourself and your family. You want to be in joy. You want to leave purposefully. You want to come to our retreats and just be happy. That's where we really want to be. And that's what decreases the burnout from a systemic process. Understanding the gaps first and understand that everything that we do is actually a subconscious response based on the things that we're taught. All right. But we're not taught business. We're not taught team execution and values as much as we should. That's why I'm so glad for you, Lauren, that you're actually providing this for the pharmacists. And we're also not taught how to engage in conversation so that we have the full value. And so the communication piece, the value chain piece, the technology gap are the 3 pieces of the triangle that has to be put together for you to succeed at whatever it is that you want to do. All right. I'm gonna take a break here. I've talked a lot, but I'm very proud of myself. I didn't curse as much as I thought I was gonna be. So, any reflections on that? I don't want to be like the one person talking. reflections, questions, etc.? Because I have more. No, this is jiving with y'all. Are y'all getting value from this?
Yes, and I'm really excited to attend Healthcare 2.0. Like, I'm even more excited just hearing even more. We've had calls together in the past, and I was really excited for that. And so now it's just like more exciting.
Yeah, awesome. Awesome. For those of you who don't know what Healthcare 2.0 is, it's exactly what I just talked about. It's multiple days of covering every aspect of this. And it's going to be the very first conference where an AI is an active participant. And instead of a billion slides that we have on the thing, we're actually going to be utilizing AI to create. You guys are going to be utilizing it yourselves to create within your system as an organization. But that's what Healthcare 2.0 is. But Healthcare 2.0 is also an ongoing conversation. So we have a 3-day event that's coming up. Wait, is it 4? It's 3.5. 3.5 days coming up. Sorry. 3.5 days is coming up. And then it's an ongoing conversation over this next year of where the system's going to go, because AI is actually moving really fast right now, much faster, way faster than I thought a year ago. And you're able to do a small thing. You're able to do a lot of things a very small amount of time as well. And part of Healthcare 2.0 is designed for integrative health and functional medicine. That's exactly what it's designed for. And it's the actual answer of how to incorporate it into conventional practice. Like, hands down. Nobody else has the answers. I'll tell you that right now. Another big part of Healthcare 2.0 is we have dentists in the room. And so the dentists that have been with me for a few years, they're in the room as well. And because we're able to incorporate that within the healthcare system, there's a way for dentists and pharmacists to actually engage as well. There's a huge referral pattern that's there as well, which is done in Magnolia Pharmacy now over here in Houston. And we're going to have different models. We'll also have the largest DSO in the nation. They'll be there at the mastermind of Healthcare 2.0 to understand what does it really take in AI incorporations of policies, procedures, systems, and processes for us to take it to the next level globally as well. So it's really this high level thing that we're actually doing. Another part is this is something that Laura and I are really big fan of talking about, is the spirituality piece. If you're on the Zoom, you are probably a go-getter. You're probably a go-getter. And which means that you're a creator and you're an artist, right, at heart. And a lot of times too much innovation can be a crux, and it can create a lot of burnout as well. The spiritual piece is something that I've been going through and Lauren has been going through. We're actually tying that together with this as well. So we created the very first spiritual-based AI and business outputs, which means the artificial intelligence foundational core knowledge base is founded on spiritual principles, right? And its job is to help all of us communicate so we're able to create that balance. So if y'all have used ChatGPT before, it's very conflicting. If you use Claude 3.5 and other large language models, that's not what the foundation is on. So we actually created the first engagement where the AI is able to help you make some decisions. So I recently demonstrated that at LifeCon, which is a conference I put on recently, and I actually spoke with artificial intelligence, and it's able to provide output based on natural language based on the spiritual integration. And you can use that to create systems, policies, procedures, so that you can create what's called a heart-centered business. And in fact, we just did 9 hours of that training. I want to gift it to everybody here. We just did it on Saturday. It's called Plan or Die. But it is 9 hours of building a heart-centered business. I want to give it to everyone here for free onto our platform, right? It's my gift for you for being on here. And I think Lauren has a massive discount for our Healthcare 2.0 process as well. But we'll love to see y'all here, like physically in person with me. So it's going to be at Texas Center for Lifestyle Medicine. I created a whole auditorium just for teaching and learning on our side. But I want to be as generous as possible to really serve the gap that most people have. Another thing is that we have partnered with Tony Robbins and Dr. Daniel Amen to deliver a really powerful training in business, heart-centered business. It's literally 6 months of a really intense MBA like process starting in February. We'll get some more information out there as well. It's something, if you are a business owner or want to operate and be a team lead and scale, like this is the actual like training that's far more valuable than anything else I've ever done. If y'all been to Tony Robbins events like UPW and Date with Destiny, stuff like that, I've been to Tony Robbins training for 21 years myself. And part of it is Mastermind. And we are basically taking the Tony Robbins business coaches and creating an entire medical sector with AI integration. So this has never been done before. Tony's super excited. We're starting that next year as well. So lots of different things coming up to really shaping the future of healthcare. But I cannot see a future of healthcare without the pharmacy piece. And I'm so happy y'all are on. And if this really resonates with you, I'll send some follow-up emails. If this really resonates with you, you want to be part of the movement, Lauren is here, right? There's a reason why Lauren is doing what she's doing, but she's also tired of being in a silo. So she's saying, let's talk to everyone. I'm like, all right, let's do it. Let's talk to everyone. We don't have to be in a silo. We have the ability to make the most tremendous impact in healthcare that I can think of in history. And this is where we actually start. So I want to thank y'all as well. Yeah.
Lauren, I know some people were saying they have to hop off at 3 minutes, which I myself also have to hop off as well. If anybody has any burning questions they want to ask, please feel free to hop off and ask very quickly. But we'll be in touch with all of the information. You'll be hearing lots more. So hopefully we'll see some of you in Houston, November 15th through the 17th. That will be the first step. So
yeah, not hopefully. I want to see all of y'all in Houston, actually.
Yeah.
And it's because I'm like, let's face it, right? This is not one of those things where you come, you train, let you go and do your own thing. This is not. This is an ongoing freaking conversation of how to get all this executed. So one of the things that Lauren and I have is that we have a really big future plan. So I have what's called a 120-year journey, a sixth generation journey, where I want my 3 daughters to be so impacted by healthcare they actually love it, right? And recently, I don't know if y'all follow me on LinkedIn, my oldest had a pancreatic cancer that was removed with a Whipple surgery. She's 10 years old. And she's the youngest person to ever have this type of tumor. She's doing great. And then when that happened, my life took a pause for 3 weeks and I came back in and I thought, is my life going the way that I want to go? I had this 3 weeks where I didn't know if my child was going to live or die. And I came back in and I texted Lauren. I was like, this is exactly where I want to be. I want to do nothing different. So I'm really grateful to be in that position where I want to do absolutely nothing different, because my 120-year plan is still making sure that future generations are going to be super proud of the medicines that we actually create, all right? The systems that we create. And the reason I got Tony Robbins involved is he is one of the people that I've admired for a very long time. I don't agree with everything he says, but at the same time, he's able to get me into my spiritual piece 9 years ago and understand my issues and my mental health previously as well and overcome that. And that the more we can create, the more we can get people from other industries into this conversation of healthcare, the better it is. So my next 10 years of my life, I proclaimed this during my retreat with Lauren. I'm like Nick Fury, where I just want to get all the Avengers in and create this mastermind and system where we can make some really humongous impacts as well. So hopefully this resonates with you. I would love to see everyone there in Houston, Texas.
Yeah, absolutely. This will not work if I am the only pharmacist at the collaborative event. It will be me talking to a room full of dentists and doctors who will be like, cool. So how do we find these pharmacists? So yes, very excited for everything. So thank you all so much for joining. And yeah, we will be in touch through email and you'll probably be seeing lots more of Cheng around here too.
Yeah, awesome. And I will stay on for another 5 minutes for any questions or comments. I'm happy to do that before I start seeing my patients today. I'm still practicing, FYI.
Yeah.
Yeah. Any questions? Unmute yourself. Is it resonating with you? Hopefully. If not, it's okay. You can curse at me just like my staff does. That's cool too. Awesome.
I just wanted to say thank you for the information. I'll be there at the conference in Houston, and my prayers go out to your daughter.
Thank you so much. Yeah.
Yes, sir. Thank you.
My daughter is actually going to be there in one of the morning sessions. She'll lead a meditation with me. So yeah. She's super excited about the conference. She's super stoked. We just had a podcast with her, and I cried multiple times during the podcast, but I was still going to release it. Yeah. Awesome. Anybody else? Comments, questions, excitement, disappointment, diarrhea, anything?
Love.
Love is a good one. Love is a good one. All right. Oh, Julie, your kids have cystic fibrosis. Oh, wow. Wow. And neuroblastoma. Oh, my heart goes with you. Absolutely. Yeah. Lauren, I don't think I told you this, but we're actually doing a parenting workshop with my daughter, my two older daughters. That's also coming up as well. It's a virtual thing. It's free for all healthcare professionals. And it's basically both my older daughters' experience on them being the daughters of two physician family members and them seeing our burnout, okay, over the last few years. And so, yeah, my oldest is 10, my middle one is almost 9, but what they have to say is creeping me out because they were on this computer to my left right here, like putting an outline. They're actually using perplexity.ai. They use the AI generator to speak and talk, and it provides an outline for them. And so it's really creeping me out what they're actually using AI for, but it'll be a good one. But that's part of my nonprofit and things that we do. But anyways, listen, thank y'all for being on. I really appreciate your time. Lauren, as always, much love to you. Representing with the PTI shirt, that's amazing. Thank you for that. And Lawrence, I know you're going to be there. Veronica, you're there, right, with me in November. It's going to be really badass. Make sure you bring a fully charged laptop because we're going to do some really interesting things that are there. If anyone else wanted to join us, it'd be absolutely lovely to have you. Thanks so much, everyone. Appreciate you.
Thanks, everybody. Bye.
Bye. All right. How do I, here we go, stop recording.